Hello, my dear friends. Welcome to Anjali's Medical Education Tutorial. In 2023, WHO made a statement that by 2030, the third leading cause for death in the world will be COPD. So, I thought that we will discuss today about chronic obstructive pulmonary disease. What is chronic obstructive pulmonary disease? It is a chronic disease, as the name indicates. It is chronic. On a fine morning, a patient is getting up and saying that I am affected with COPD. No, that is not the case. It is chronic. It is progressive in nature, and it is a disease that is affecting the airways and lungs of the human. And it is irreversible. The change that occurs in the lungs and the bronchial tubes is irreversible with the bronchodilators. Now, the mainly two diseases contribute to this disease condition COPD, that is chronic bronchitis and emphysema. The predominant one is the chronic bronchitis. In chronic bronchitis, we know that the air we breathe in, it travels through the trachea and then to the bronchi, then to the bronchioles, and at the end of the bronchioles there is alveolar sacs. So in chronic bronchitis, this bronchi, the narrowing in any inflammation occurs due to any infectious reasons. Inflammation of the tubules occurs. This inflammation will cause narrowing of the airways, and narrowing of the airways will hinder a resistance for the free flow of the air inside the lungs, inside these tubes. So, and also the mucus that is produced will get accumulated in this narrowed airways, and due to the accumulation of the mucus also further blockage is occurring, and then the airflow is further affected, and then the patient will start developing the symptom of cough and breathing difficulty. If a person is having a chronic cough for more than 12 months continuously, then we will consider it as a case of, or the patient is moving towards the condition COPD. Now, what is emphysema? In emphysema, as I said earlier, there is elasticity maintained in the lungs. This elasticity will help the air to move into the lungs, and force during the time of expiration, the air is forced out of the lungs with this elasticity of the lungs. So this elasticity is affected when the air is entered into the lungs, in the airways also, in the alveolar sacs also, air get trapped inside. That is why a prolonged expiration will be there in emphysema patient. This trapping of the air results in the alveolar destruction. So where the gaseous exchange takes place is the alveolar sacs. That part is affected. This alveolar sacs contains numerous capillaries, capillaries, and that will supply blood to the capillaries, and the air exchange will takes place. When the air is trapped inside this alveolar sacs, that will lead to the destruction of the alveolar sacs, and that is how the development of the emphysema. So this is the two disease condition that contribute to the disorder COPD, chronic obstructive pulmonary disease. Now, moving towards the etiology of the COPD. Based on the etiology also we can classify the COPD. For example, if it is a genetic reason, sometimes the COPD might be occurred in a patient due to the genetic reason, such as deficiency in the alpha antitrypsin. This is a protein that is produced by the liver, and it will help in the lung maturity. So when this protein is not produced by the liver, that will affect the development of the lungs. So that is the reason why we say genetic reason, that is decreased or deficiency of the alpha antitrypsin, will result in the development of lung disease such as the COPD. And also it causes problems to the liver also, since it should be produced by the liver. So lack of productivity from the liver for this protein will cause harm to the liver also. And now the second reason is the second cause. The cause is the poor lung development. This poor lung development can occur in low birth weight baby or prematurity. And the third type of classification based on the etiology is the exposure to the fumes or fires, burns and all, industrial exposure or exposure to the chemical pollutants, occupational exposure of gases and all. And one of the main leading cause for the COPD is the cigarette smoking. This cigarette smoking can be not only the active but passive, and also in utero exposure of the cigarette smoking can also result in the poor lung development and leading to the COPD cases. And sometimes due to the infection that is occurred in the childhood, like childhood TB or any HIV infections in a person, so in that case also COPD can develop in the later period of life. And asthma. Earlier, this asthma, chronic bronchitis, emphysema together contribute to this disease COPD. But now the asthma is excluded. Only the chronic bronchitis and emphysema contribute to the formation of this disorder COPD. So asthma is also a reason. Exposure to the allergens and asthma is also a reason for the occurrence of COPD. And unknown reasons. Unknown reason is also there for every disease. Most of the disease there will be an unknown reasons. In the case of COPD also an unknown cause is there. So today we discussed about what is COPD and what are its causes, how we can classify the COPD according to the etiology, and what are its what are its symptoms. So for today's episode, let us just concise to the definition, the causes, the classification and the symptoms. So in the next part we can talk about what are the diagnostic investigation to rule out the COPD cases, and the pathophysiology of COPD and the management for COPD. And thank you for today. And if you found my video helpful or like my video, please do subscribe, like and comment for this video. Thank you so much.